Welcome to Hot Takes, a series from Red Hot Healthcare that delivers thought leadership to viewers and listeners in under 12 minutes. We have no softball questions and no sales pitches from our guests. And I'm your host, Steve Ambrose, and we're going to get right into today's hot take from Dr. Apurv Gupta. Apurv is vice president at Premier, where his focus and where he's made his bones has been helping hospitals and health systems in clinical governance, change management, and process redesign. Apurv, we had a really good interview last year at HIMSS, and I really appreciate you making the time to jump on in here on this hot take with myself and our audience.
Of course, Steve. It's been a pleasure. I'm so glad I got connected with you last year. And over the course of that time, I really feel like we've become good friends. So it's a real pleasure to be connected here with you. And thank you for inviting me to be on this show.
Okay, let's jump right in. Apurv, you see a really big opportunity for care transformation involving something that you call empathetic automation. So, give us a down and dirty on what that term means, and then maybe one or two examples of where you see it making a really big difference for provider organizations.
Sure, Steve. Yeah, thank you. As you know, I'm extremely excited about this idea of empathetic automation because of the promise I think it holds. Ultimately, to automate so many clinical processes that doctors and nurses are involved in every day, rote, mundane things that they don't really need to be doing, but somebody needs to be doing. They need to get done as part of the clinical process. And yet, we're not using our technology wisely. And when we do so, we can really open up this window for empathy, not only to take care of our patients better, but also to take care of our doctors and nurses who are taking care of our patients. So the opportunity is pretty tremendous, leveraging all sorts of technologies that are already available at our disposal. I'll give you a couple of examples, Steve. One is on the doctor side and the other on the nursing side. For the doctors, what we find is that they often need to take care of patients in terms of thinking about them for the primary clinical condition that they're presenting in. So, for example, a patient might have congestive heart failure or stroke or acute MI. They may have multiple other things also going on, but the primary medical condition kind of helps us to organize our thinking around what's required to take care of that patient. And yet, in order for me as a clinician to figure out what needs to be done, I have to go to many different parts of the medical record. I have to go to the labs, I have to go to the meds, I have to go to the past medical history, I have to go to the vital signs, and all of that, each thing takes a click, takes waiting time, takes me to remember all the different areas of the chart that I need to query, and I'm hoping that I don't forget, any of these things. I'm hoping that I have the time to actually go and hunt out for all this information. Well, with the power of automation, we can actually scour the medical record, compile all the information by the clinical condition, and present that back to the clinician. So they just have to go to one place and can see all the relevant information about that patient in one view. It saves the doctor time, it makes them less frustrated, and again, it frees them up so that they can actually spend a little bit more time taking care of the patient. That's something we're doing in pilot format at a couple of different clients, and we're hopeful that that's going to, demonstrate the benefits that we're talking about. On the nursing side, it's a little bit similar, but nurses, for example, are often asked to create a medical history in many cases. And the information is also there in the medical record, but it's not compiled in the same place. So they often have to go and hunt around for parts of that medical history when they're creating a new record for pre-admission physical, for example. They may even have to requery a patient for information that's already in the medical record, which creates frustration for the patient. How many times as we have patients often felt like, hey, didn't I already give you this information? So now with the power of automation, we should be better able to pull together all this information from the medical record, present it to the nurse in a way that they can quickly review it and understand what's there and what's missing, and then open up their time to spend more wisely with the patient, again, to express and create more empathy, but also to follow up on just that part of the medical record which is truly missing.
Apurv, let's talk clinical variation. For a long time, clinical variation has been a lag on, outcomes and costs for providers. Two questions I have here. First, when it comes to clinical variation and transparency to consumers out there, individuals and maybe self-insured employers, do you see transparency as important? And then the second is, maybe speak a little bit to the ROI that providers can and maybe should be expecting around making investment into, clinical variation.
Yeah, Steve, I think it's an incredibly provocative question that you're asking. And I think, implied in the question is the answer because yes, transparency in general, I think brings in the light and brings in a breath of fresh air and allows more people to be participating in the process. So right now, I think the assumption is that from consumers and payers and employers, the groups, the people that are really consuming the care or paying for the care, I think they assume that healthcare systems and provider groups are really taking care of the clinical variation. And ultimately, they're looking for metrics, but they're getting average metrics rather than individual metrics. What would happen if we actually started to provide those individual physician level or facility level metrics to the consumers and to the payers? I think it would actually make a very dramatic outcome. And it's the kind of thing that's probably needed because for the most part, it's been really difficult for health systems to try to create these outcomes on their own. It involves changing the practice of doctors, and no administrators really want to get into that. It's very hard to be dealing with highly educated and highly experienced practitioners and trying to get them to change what they do. But I think the power of the data is really ultimately what we're talking about. Once you make that data more freely available, you clean it up, validate it appropriately, risk adjust it, make sure that you're attributing it properly to the right physician. Now, not only can the health system and the physician group actually exert some really appropriate supervision over the process, but if you can share that data more broadly with the consumers and with the payers, then they can also have a say using their purchasing dollar, right, and the right that they have in choosing their site of care in making a determination based on where they're getting the better outcome. So I love the question. I would love to see the industry move forward in that direction. With respect to ROI, I think it's actually pretty dramatic. The ROI that we can measure for many common clinical conditions, medical conditions like sepsis or pneumonia, or COPD, or even surgical conditions like hip replacements, it can be as high as 10 to 20%. And I think, if we look at it more broadly, because ultimately everything in healthcare is related to what the physician is driving. So if you can actually get physicians to be more standardized in their care, that can impact the overall care process much more dramatically. And I would suspect we'd get even greater returns than the 20% projecting.
Let's talk about throughput in hospitals, and that's an area that you made a lot of your bones in. It's a really biggie again for costs, especially today. What are some of your thoughts, Apurv, on where the biggest shifts and changes need to happen on both the human side and the technical side involved with throughput?
Mhm. On the human side, Steve, I think the issue is we're still talking about throughput in 2023, and many of us have been working on it for decades. So throughput itself, even though patient care has become a little bit more complicated, there's more pressure on hospitals to try to get patients in and out of hospitals. Ultimately, throughput is still the same issue. So why are we struggling with it? It's because ultimately, as soon as we think we've solved throughput on the human side, the clinicians, the clinical leaders, the administrators, we turn our attention to something else. So that's the biggest improvement that I've seen many of our clients make over the last couple of years is create a mechanism by which you have ongoing insight and oversight over the throughput process. Whatever's happening on a daily basis that's messing up your throughput, barriers that are coming up, discharges that are not happening because you couldn't get a bed at a rehab facility or because a cardiologist wasn't able to come to see the patient, how quickly is that information flowing to the executives? We call it daily operational oversight. The quicker you can get that information into the hands of executives, hopefully on a daily basis, the sooner you can have more people involved in helping to solve that issue. That's what solves the throughput game. One patient at a time, but making sure that that information is freely flowing across from clinicians to clinical leaders to executives. On the technology side, as you mentioned, we're just not leveraging our technology properly. Everybody's implemented an electronic medical record system, but is it optimized for throughput? Are we clear that when the patient pathway for that particular clinical condition is up to date? Are we using the opportunity for entering in conditional orders appropriately, for identifying patients that are ready for discharge, for coordinating care, in even earlier, as we were talking about an empathetic automation, for compiling the information so that people are wasting less time, not waiting around as much for the information to come to them. These are the things that are causing delays in the care process, which leads to delays in throughput. So love your question. Hopefully the audience gets a good sense of there are definitely things that we can do as administrators to watch over the process more judiciously and ongoing. We can't let our eyes off of this, and we should be better leveraging our technology to have our patients more effectively, efficiently, but also expeditiously and appropriately moving through the system.
Thanks, Apurv. It's always great to catch up with you, and really appreciate you coming on today.
Oh, what a pleasure, Steve. Thank you. I really appreciate your questions, and I hope that this is going to be educational for our audience.
Thanks to those watching and listening, and you can subscribe to Hot Takes and get every show update by visiting redhothealthcare.com. Thanks, and have a great rest of your day.